My name is Rachel, and I have had an ileostomy for about 2.5 years now. And I am getting it reversed in 3 days. So I thought I would make a video doing my hopefully last bag change before I don't have an ostomy anymore. And try to go through the process of what a bag change is like, how it works, and kind of my history with having an ostomy. This isn't scripted or anything, so I'm just gonna kind of talk as I do it and hope for the best. So I have been wearing a clear bag recently, just so you have time to click away if that's not something you want to see, because it is just a bag of feces on my stomach. So this is what it looks like right now. And I know it needs to be changed because around the outside you can see it's starting to leak a little bit. So that means we need to take this bag off and put a new one on. I have all my supplies laid out here, and I will probably edit in a picture of what that looks like. I'm not really specific to any brand or anything. I buy supplies off of Facebook Marketplace when it's available because that's a lot cheaper. But this is kind of what I generally use. Usually I do this sitting backwards on the toilet so that if anything were to leak out of my stoma, that it would get caught. But today I have a trash can here to catch anything. But I also haven't eaten in about 12 hours or so I'm hoping that my stoma will be fairly cooperative today. So first thing you need to do is take off the old bag. So I have adhesive remover wipes. So just take one out and open the little package. And then just go around the outside and try to take it off. And you could just rip it off, but because something is going directly back onto the skin, it doesn't really have a lot of time to heal. So you don't want to be too aggressive with it. But as you can see, it is a mess and definitely needed to be changed today. A bag will start to leak just on its own after a few days. If I don't have any problems, mine usually lasts like 5 to 7 days. Some people it only lasts 12 hours. It just depends on the system you have and how active your stoma is. But there are some situations in which the bag will start leaking early. Like if I leave it overnight and I don't wake up in the middle of the night to change it, then the bag will start to overflow and leak out the edges. Wearing any kind of tight-fitting clothing can also do that. So I have worked out a system with my own ostomy where if I'm capable of wearing something that's more tight-fitting, but I know not to eat for so long before it. It probably needs to be at least 12 hours or so. Otherwise, the bag will start to fill and will start causing problems. I've had an emergency bag change kit in my car for 2.5 years now, with a change of clothes and everything I need to change my ostomy bag. And I've had to do it opening night of 2 shows before. I've had to do it at Celebration Station, at church, at pretty much anywhere you can think of. Grocery stores, retail stores. You just get this feeling that there is something on your skin that shouldn't be there, and it starts to burn. And that's kind of when you know that you need to be doing something about it. So I have taken all of the adhesive off, and there's no residue of anything on my skin right now. You'll notice that the area is still pretty red, and that is just what happens with adhesive. You can be allergic to certain adhesives or adhesive removers, and I have never had a bad enough reaction that I felt like I needed to switch products. But it's definitely something to just kind of be aware of, especially because you can see the red outline is where that product was. Something that some people do to combat the redness and irritation is use a stoma powder. And I kind of go back and forth between using stomaadhesive powder, which is like a general over-the-counter kind of thing that you can use. But then I also have nystatin powder that is prescribed by my colorectal doctor. And this helps more with like yeast infection kind of things. But how this works is you just put some all around the skin, and then just kind of make sure it's all coated. Okay, and because my skin is a little bit irritated right now, I'm gonna try to let it sit for a minute and like air out the skin, give it a chance to like get some fresh air and try to heal. It probably doesn't matter too much because I'm getting it reversed so soon, but still good to do, just out of habit, I guess. So while I'm giving that some time, I thought I would talk about why I have an ostomy. So I started experiencing symptoms of Crohn's disease back in 2009. I was 8 years old at the time. Needing to run back and forth to the bathroom, really bad stomach pain. I would get constipation or diarrhea all the time, nausea, vomiting. I couldn't be active at school. My fatigue was too much. I didn't have any endurance. And I just had to be next to a bathroom at all times. And the way that diagnosing Crohn's works when you're that young is they have to rule out everything else first. So they did all kinds of different x-rays and CT scans, and finally ended with a colonoscopy, which showed inflammation throughout my colon. And it is a chronic condition. It can never be cured. It will never go away completely. But it can be treated. There are medications out there that help the symptoms subside. So I was diagnosed when I was 9. Sorry about that. And from there, I started a medication called Pentasa, which was a pill. And it was the first pill I had ever had to take. And it was a pretty big one. So I learned how to take pills when I was 9, and I was on that medication for about 2 years. And then it wasn't as effective anymore. So I was started on Remicade infusions. So I was around 11 years old, and every 4 to 8 weeks, depending on how severe my Crohn's was at the time, I would go to a hospital nearby, and they would put in an IV and infuse this Remicade medication. And I would be there for a couple hours. And it was fine. It was a medication that worked really well for me. I had a great pediatrician, pediatric gastroenterologist, and they took great care of me. I was on Remicade for 5 years when I was told that it was about time to start looking for an adult gastroenterologist. So I did that, and I switched to a different doctor. And he looked at my case and said, well, yes, the Remicade is working, but I bet we can find something that works better. So I was taken off of the Remicade and started on Humira. Humira was a traumatizing drug for me to be on. I think I had one of the earlier stages of it. They've changed their formula since then. I haven't tried it since they've changed their formula. But when I got it, they were auto injectors that would go into my thigh. And it caused some of the worst pain I've ever felt in my life. This horrible burning sensation. And it felt like fire going through my leg. I had to do that at home every 2 weeks for maybe 2 years or so. I looked up how to ease the pain. Apparently there are a lot of people who had similar experiences with Humira specifically. I tried ice, I tried numbing creams and things like that, but nothing seemed to help with that. I had nurse friends come over and try to do it for me, and they were also saying, like, this is not something that should be happening. Finally, I went back to my doctor and explained that this is happening, and I said that multiple times. They didn't really care. But finally, one day I was having such a bad panic attack because I couldn't do that to myself. I couldn't let my mom do it. We went to the doctor's office and said, like, if you want me to have this, then you do it. And one of the nurses there went to inject me with it and saw my reaction. I curled up in the corner and started sobbing and screaming. And that was like, they saw what was happening and decided to switch me off of it. Not to mention the Humira did not work at all. I was having really bad Crohn's symptoms at the time. I was in and out of high school for multiple reasons, but the Crohn's being one of them, that I would go to school for a semester and then have to switch to online because I couldn't get to school every day and I was having so many accidents. Not a good time. After being taken off of Humira, I was put on Stelara, and that one also did not work, but I was on it for about a year. it was just like a regular syringe I would inject myself with. Like, I think that one was every 4 weeks, if I remember correctly. It's a period of my life that I don't remember too much. It feels like my brain has blocked out a lot of memories of this time when I had these physical health complications. I had some mental health stuff going on at the time. Crohn's is just the beginning of my grocery list of diagnoses. So far, physically, I've been diagnosed with Crohn's, scoliosis, spina bifida occulta, thalassemia beta. It was trait at the time, but I think they go by minor now. Rheumatoid arthritis, Tourette's, and asthma. I have had my large intestine removed. I have had a hysterectomy. I have a bladder stimulator. But I'll get into that more in a minute. I think my skin has had enough time to air out that I can move on to the next step. So next, it's technically an optional step, but it really helps the skin not get so irritated. I put a barrier, the liquid barrier between my skin and where the appliance is going to go on. Sometimes they come in wipes. This one has worked the best for me. It does really burn my skin, but it also helps the bag stay on the longest, so I'm willing to put up with some pain as it goes on, so I don't have to do this as often. So it just comes in a little wand and goes around pretty much everywhere I just put that powder. And I know generally about how big my appliance is. It's okay if it goes a little bit over, if it's a little bit under. You're really just trying to protect the skin directly around the stoma. Sometimes it's hard to see under it. Stomas come in all shapes and sizes. Mine is, it comes out of the skin. Some people's are flush with the skin, so it appears flat. Some people's go down into their stomach. I also have a peristomal hernia right now. So my skin is already kind of like, it has a bump where the stoma is that is more protruding than it usually is. But actually, as you can see, my stoma is starting to leak a little bit. And that's just how it works. It's literally a piece of my intestine that is coming out of my stomach. And this is just the way that my intestines are wired right now. So right now, nothing is coming out of my rectum. It is all coming out of my stoma here. That does need some time to dry. You want to wait until it gets kind of tacky. So I guess back to the medications that I've been through. After Stelara, I was on Entyvio for maybe a little bit over a year. And that was another infusion that I had to go to a center, and I believe it was a center for treating cancer. But they did these kind of medications as well, because some medications that treat Crohn's are just variations of chemotherapy in very, very small amounts. So after that, I I knew that it was time to change doctors. The doctor that I was seeing, it, we were informed that their office was getting paid to promote certain medications. So even though I found something that worked, their office got money to put me on something that didn't work. And that's why they took so long to switch me between medications, to give it a chance to work, um, despite knowing that something else already did. So I ended up switching to a new doctor that has been fantastic, and I'm still with them today. They um, this was around October of 2020 when I saw them for the first time. And they said, well, like, if the Remicade worked, then we're going to try to put you back on that. They did some blood work and tested my antibodies level to see if it was even a possibility that I could go back to the medication. And I did try a few infusions, but my body had already built up antibodies to the medication, so I couldn't go back to it. Like, it would go into my system, it just wouldn't absorb properly because my body has learned to fight it off. At that point, I was told that I was out of options in terms of medication. My large intestine was diseased beyond repair and needed to be removed. So it took a while to actually get on the schedule, but on July 6th of 2021, I went, I had the surgery to remove my intestine and form the stoma. It was called a full colectomy and ileostomy. So it took a while to get used to this. I knew nothing about stomas or colostomy bags or anything like that. I knew that it was a possibility with Crohn's, but I kind of that feeling of like, that's never going to happen to me though. But my Crohn's got severe enough that it was necessary. People can get stomas for a variety of reasons. I've known people that had them because of birth defects or cancer. But Crohn's is not an uncommon reason to have one, or ulcerative colitis. Ulcerative colitis and Crohn's are very similar. Ulcerative colitis just appears in the colon, in the large intestine. So it makes more sense to remove that if that's what the diagnosis is, because it's not going to come back somewhere else. Crohn's can affect anything in the digestive tract, from the mouth to the anus. So yes, I had my large intestine removed. They removed all of the diseased portions at the time. I am still in remission now, but there's always the risk that it's going to come back in my small intestine or anywhere in my stomach to esophagus. And that could be a year from now. It could never happen. We just don't know, and it's something to keep an eye on. And I have regular appointments with my gastroenterologist. Going over markers. I get ileoscopies once a year, unless there's like a problem that they need to do extra ones. An ileoscopy is the same thing as a colonoscopy, but it goes through the ileum because I don't have a colon for it to go through. So that has been my experience so far. I have been cleared to have my ostomy reversed. So they're going to take this portion of my intestine and put it back where it belongs and connect it back to what remains of my rectum. And I will have scars on my stomach, but I should be able to function as a normal person again, or at least my normal. I am part of a lot of support groups on Facebook for this kind of thing, and go on Reddit and Google trying to find more resources. And I've seen a lot of people saying that they got their ostomy reversed, but here are some things to look out for, or don't plan on going anywhere for the next month because it takes a while for your body to readjust. My rectum has not been used in 2.5 years. So even before getting my scopes, I had to do an enema recently, and it was incredibly painful just because nothing has touched that area in so long. So it's going to take some getting used to, but I am excited to give it a shot. It's likely I will need to get an ostomy back at some point, just depending on when the Crohn's comes back and where and how bad it is. I have exhausted most of the medications out there. They're always coming out with new things, and I'm with great doctors now that are able to suggest clinical trials. But that's not something I need to look into yet, just because it appears as though I don't have any inflammation right now. So that has kind of been my experience with the medication side of things. So I think my skin is ready for the actual bag to go on. My first step with this process is to put on a barrier ring. So this opens, and then there's a piece of plastic on either side that comes off. And then this ring stretches, and I need to make it just big enough to go around my stoma. So there is that. And that just works as an extra barrier to keep any feces from coming out the sides. This takes longer to break down than the actual appliance does, so it helps. Just because there is so much acid in what is coming out of here, it will break down skin, it will break down the material that is used for this. It just helps it last longer. There's no need to wait in between steps for this part. So I have the actual appliance. I use a 2-piece. So you can either use a 2-piece or a 1-piece for this type of ostomy. 2-piece means that the base plate and the bag are separate pieces, and these kind of click together like Tupperware. A 1-piece it comes like this, already put together, and you can't detach it. I prefer 2-piece because I like being able to let air out of my bag sometimes. I think it lets me see my ostomy better and place everything correctly. And then also, if anything were to get on my bag, I could just change the bag and I don't have to go through this whole process. It takes maybe 10 seconds to take off an old bag and put one on. But if I need to change the whole thing, I've done it in 5 minutes before, but it doesn't usually last very long. If I want it to be really effective, it can take anywhere from 30 minutes to an hour, depending on how long I want to let the skin air out, what type of adhesive barrier I'm using. Just that's kind of my average. So this part peels back and we're left with this. So what you want to do with this, it's already about the size of my stoma, but generally this one is moldable, so you can pull it back to make the hole bigger if you need to. That is specifically a perk of this specific Convatec bag. But most bags, you have to take a pair of curved scissors and cut out the hole to your exact size. So I just peel the plastic off the back and then peel off the white parts here. And then that goes directly on there. And then just press it down. And I like to hold it here for a little bit to make sure the adhesive really sticks. Yeah, so there's the 3 main brands of ostomy supplies in the US at least are Convatec, Hollister, and Coloplast. And I have had great experiences with both Convatec and Coloplast. Hollister I'm kind of neutral on, but I haven't found a bag that just didn't work for me. And I have been very lucky in that sense because a lot of people, only one brand works, or only one brand they're not allergic to or doesn't cause irritation. Okay, so from here, you can do one of 2 things. If you want, you can just put the bag right on, but I like to reinforce this a little bit. So I take these barrier strips, and again, you just peel off the back, and I put it right around the edge of the system. So there's that part. And it's okay if it doesn't go like all the way around. These come in packs of like 14, I think, something like that. So you can use as many as you need, but I just try to make do with 2. So there is that. And now I add on the bag. And this can hurt sometimes because I have to press really hard, and especially with the hernia, it's not a pleasant experience. But I make sure that it's not dripping. I'm gonna wait for that little piece to come off. Sometimes just by like shaking it a bit, it comes off. And then this, you just need to really press it on there. And again, it works like Tupperware, so you will hear clicking sounds when you know that it's in the right place. have to look around and make sure that it is all on there. So I don't want this leaking. And I think we're good. I was using a clear bag earlier because it came as part of a kit. Like when I go home from the hospital, they have a clear plastic bag that has a set of an adhesive remover, a skin barrier wipe, the appliance, and the bag. And I just used one of those because I was out. But this is what I generally use. And it's nice because I can wear it on the outside of my clothes without showing everyone what is inside. And I have a great roommate who doesn't mind if I wear this just around the house. So yeah, that is that's how you put on the bag. And then the one last step that I do is use a deodorant. And the top just comes off. And then pour a good amount in there. Close this back up. And then the bottom part, it folds. And then there's a piece like Velcro here that closes it up and it stays. So then I just kind of like to redistribute the deodorant around a little bit. And it's lubricating, so that helps the bag empty properly when it is time to empty it. Because I use a bag that has an open end to it, like when the bag is full, I undo the Velcro and just kind of squeeze everything out. And I have to do that multiple times a day, just kind of like as often as you would go to the bathroom. Maybe a little bit more because gas also gets trapped in the bag and you have to let all of that out too. But some people prefer to have a closed bag that they have to remove and put on a whole new system every time they have to do that. My intestines personally are way too active to do that and for me to be able to function. Also not financially viable. I would much rather have a bag that this will last me 5 to 7 days usually. So without insurance, a 1 month supply of all of these supplies costs a little over $800. And that's going through a manufacturer that is willing to work with people, and they have decent prices compared to other manufacturers. Or I guess this is a distribution company, not the manufacturer. So yeah, I think with insurance, after I've met my deductible and out-of-pocket, which I do in January every year, it still costs between $40 and $50 for a month of supplies. And it's not really something you can just go to a store and buy. You have to buy it through a website that then ships supplies to your house, which is why I usually use Facebook Marketplace, because I am in an urban enough area that there are a lot of people here, and you can find pretty much anything on Facebook Marketplace, or I'm sure eBay would have supplies and that kind of thing. And a lot of people are just looking to get rid of whatever they have left. So I'll buy a box of that and then get what I can out of it and then resell the rest. So that is my completed ostomy bag. And then that can just get tucked in to whatever I'm wearing. And you'd never know. Most people that have an ostomy probably you wouldn't know unless they told you. I personally am very open about my medical experiences and journey and all of that in the hopes that it can help other people. But there are a lot of people who prefer to keep it very private. I've seen people that wear beautiful like evening dresses or swimsuits or that kind of thing and find ones that will cover everything properly. But there are days when I don't want to deal with that because usually it is something that is like, especially for a swimsuit, I would have to not eat for 24 hours before going swimming if I don't want my bag to cause problems for me specifically. So there are times and places that I feel comfortable wearing my bag on the outside of my clothes. There's no problems with swimming or bathing or anything like that. And honestly, it's really nice to take a shower without wearing any kind of appliance or anything. Just the skin and the stoma are out. There are no risks with that, really. You don't want to get soap on the area around the stoma because then it's hard for adhesive to stick to it. You only want to use water-based wipes, nothing with any moisturizers or fragrances or anything like that. So I think that's kind of my experience with this. I've had friends and family members ask what that process is like or ask if I can show them. And we're at a point that I am out of time. So here's to hoping that things go really well in 3 days and I can get my ostomy reversed with no problems. Yeah, it'll be weird not having this just because in the months before I got my ostomy, I had a job and there were multiple times I didn't make it on time or I had to pull over to a gas station on my way to work. I would have accidents in the car on the way there. I ran into all kinds of problems, and then getting my ostomy was the best medical decision that was ever made for me. Unfortunately, that did lead to other problems. I mentioned earlier that I have had a hysterectomy. So I had my uterus removed for multiple reasons, but one of them being scar tissue had adhered to my uterus and was causing immense pain. That combined with other symptoms I was having, it was just easier to remove it. So I still have my ovaries, but it has been a very difficult thing to come to terms with. Because of all of my illnesses, both physical and mental, I decided when I was 15 that I didn't want to have biological children. And this decision is going to be different for everyone. But I personally did not want to subject someone to dealing with everything that I have. And that's not to say that anyone who has that is lesser. I would be more than happy to adopt a child who had any of this. I personally just look at it as cruel to bring a child into the world who is going to suffer with this, if I know that that is a possibility. But even then, after getting my hysterectomy, you kind of realize how many people around you talk about their kids or their pregnancies, and it's different when the decision is taken from you. like people close to me are getting pregnant now, and I don't know how to feel about it. I am happy for them, but it does take a mental toll on me just knowing that that's something that I will never have. And that's been my experience with a lot of things medically, is seeing people that maybe don't have scars all over their stomach and have to go to the hospital all the time. I have a lot of friends that don't even have health insurance because they can't afford it, and I can't imagine a life where I didn't have that. I wouldn't survive. This surgery to reverse my ostomy, without insurance, I got an estimated bill on the app that I use to see my medical records, and it's about $250,000. And that is before any other tests or the hospital stay. This is just the surgery that costs this much money. And it's a huge problem in the US specifically, that people just can't afford things. I'm lucky enough to be young enough to still be on my parents' insurance plan. But if I had to do this alone, I wouldn't be able to. I have also, towards the end of 2022, I had something traumatic happen in my life. And my bladder stopped working all of a sudden. And yes, it was because of the trauma that happened, but also I have had so many severe abdominal surgeries that my bladder lost elasticity and just decided to stop functioning. So I had a urinary catheter for a while that would just like a bag that stuck to my leg that I would have to empty all the time. I tried straight cathing. I did everything I could, but then ultimately got an Axonics bladder stimulator put in my back, and there's a decent scar there, but also life-changing. I didn't know that I had dealt with retention all my life. And this, I didn't realize that it's not supposed to hurt when you go to the bathroom. And it's been a lot of things like that over the years that just, this is my normal, and I can't comprehend a life outside of that. I was diagnosed with asthma recently, and I have dealt with these symptoms for my whole life, but it never occurred to me that this is not how people live. So I am disabled, and I am doing my best. And I'm hoping that by sharing my story and experiences, I can help other people navigate their own chronic illness journeys better, and help friends and families of people that have any of the things I deal with become more educated about it and maybe learn something that can help someone else. So yeah, I think I'm going to wrap this up now. If this goes well, I'll try to post other videos, maybe talking about some other things that I've dealt with over the years, or going into more detail about things. Feel free to ask any questions you have, and I will try to get to them before my surgery happens. If it's after, I can still respond, and I'm always willing to have a conversation about this. I have met people who are ashamed of the physical illnesses that they have had. And I dealt with that for a while. But after dealing with Crohn's for close to 15 years, I have just come to accept everything that gets thrown at me. And I want my life to mean something, and I'm hoping I can do that by helping other people. I have been recording for about 50 minutes now, so I'm going to wrap this up. I doubt anyone will watch the whole thing, but I'll probably just put this up unedited and hope someone gets something from it. So, thank you for watching.